Are you suffering with headaches and wondering if it's coming from your neck tension? Maybe you regularly have neck tension, but you've just recently started having headaches and you can't figure out any other explanation for it. And you're wondering if this is what's causing your headaches or if you should look into something else. Well, that's what we're going to talk about today. One, we're going to talk about how to know if your headaches are actually coming from your neck pain. Two, we'll talk about what you should and should not be doing, including using ice and heat for your neck and shoulder pain. Three, we'll talk about simple stretches and exercises you can do right now at home if you do feel like your neck pain is what's causing your headaches. Ready? Here we go. First, is neck tension what is causing your headaches? Now, there's a lot of different causes for headaches, and I'm not trying to say that this is for sure you, but this will help you understand if your problem is actually coming from neck pain. So there's lots of reasons. It could be something you're eating, it could be how you're sleeping, it could be because you're dehydrated. There can be a lot of reasons why you're suffering with headaches, but if this is a newer thing for you, you didn't have headaches, you haven't had them all the time growing up or whatever, and this is a new experience for you, it could potentially be that your neck tension has increased and it's putting a lot of strain on your head, which is causing headaches at this time. Now, headaches that come from neck tension usually start in the base of the head, so right at the base of your occiput, which is your head bone, and they'll come up over the top, and sometimes they'll even go behind one eye. And that's because a lot of the cranial nerves, so the little nerves that affect our face, can be found right at the base of our neck. That's where they live, that's where they start from. So when there's a lot of tension at the base of the neck, then this puts a lot of stress on those cranial nerves, including the ones that go to the eye. Now, some people will describe the tension headache as more of a headband that goes around. Think like 80s headband type thing, right? That goes all the way around and feels like it's just a really constricting pain. That can also be caused by tension in your neck. So if this sounds like you, chances are good that it probably is that neck tension that's increased to the point that it's causing some headaches. So what do you do about it now? Do you use ice or do you use heat? Well, if you're having tension at the base of your neck, the best thing you can use is ice. Ice is a positive pain inhibitor, which means it decreases your pain, which is going to help you feel better faster. Heat does not have that effect, although we'll talk about heat in just a second. If you're going to use ice, I recommend only doing it for 3 to 5 minutes. That's really all you need. That's what the research has proven will help to have the maximum amount of pain inhibition, or to decrease your pain and make you start feeling better quicker. So 3 to 5 minutes of ice. If you don't have an ice pack or you don't have access to ice, you can take a washcloth and wet it, put it inside of a Ziploc bag, throw it in the freezer for an hour or two, and that's going to get nice and cold and be able to help you use that regularly throughout the day. Now, ice is a lot like taking any over-the-counter medication. It is a Band-Aid technique, so you're going to want to do some of the stretches and exercises that we're talking about later in this video, but when it's really bad and you just need something to get you going, ice will be really, really helpful. So definitely recommend you start with that. Now, if a lot of your neck tension is not only in that upper neck, but it's also coming down into the shoulders, that would make perfect sense. So a lot of the muscles that start at the upper part of the neck attach into the shoulders. So you've got the scalenes in the front, you've got upper trap in the back, you've got the SCM in the front, you've got levator scapula in the back. So there's a lot of muscles that attach from the upper neck also into the shoulder, or the scapula, which is the shoulder blade, and it just kind of covers this whole area. So if you want to use heat, what I recommend is that you put heat along your shoulders. I love those like rice packs, or there's different things that you can warm up in the microwave and kind of get a little bit of a moist heat. Then you drape it over your shoulders. That can feel really good for those muscles and help get them loosened up a little bit so that the stretches and the exercises that we're going to do next can be more helpful. So I definitely recommend, if you're going to do heat though, do it on the shoulders where there's bigger muscles. Okay, we want to make sure that heat increases blood flow. If we increase the blood flow, we want to make sure that there's muscles that are able to deal with it. When we do heat on the upper neck, what happens is that those joints in there can get really swollen or distended, or they kind of puff up. That can actually increase the stiffness of the joints in our neck, which will cause a problem because that will make it harder to move. And the harder it is to move, the more tension we perceive. So I don't like to use heat on the upper neck. I definitely prefer ice for that. I prefer, if you're going to use heat, to use it more on the shoulders. And that way you have that bigger muscle mass to be able to move that blood flow through. Now, I've had a lot of people ask me, can I do both at the same time? Can I do ice on my upper neck and then heat on my shoulders? And that's absolutely fine. In fact, it may be recommended for you, especially if you're very sensitive to ice, which I know some people, they just get really, they tend to get more tense when they have ice on them. And so then that's not helpful if you're trying to work on muscle tension, right? Then I definitely recommend go ahead and put some ice on that upper neck, but then drape that pack along your shoulders. It'll help improve your core temperature and make your body feel warmer overall. So you get the benefit of the ice and the heat at the same time. Now, if you do have a lot of that upper neck tension and it's causing those headaches that are coming over and behind the eye, what can you do? What are the motions that are going to be safest for you? That's what we're going to discuss next. First, we want to go through what we call some active range of motion. So we just want to get that neck moving in a pain-free range. Now, all these motions I'm going to show you, I only want you to go as far as you can pain-free. If you start to sense any pain with these motions, don't go that far. So the first motion we're going to start with is a simple rotation. So you're going to sit up nice and tall and stack your head on top of the rest of your spine. And then you're going to turn and look as far as you can over one side of the shoulder. And then you're going to turn and look over the other shoulder. Now you want to do this nice and slow. You should not be trying to hurry while you're doing this motion. It's a nice slow motion from one side to the other. And remember what I said, if you get part way and you're like, oh, that's painful, don't go that far. Stay just short of that and then go as far as you can to the other side. Again, pain-free. You want to do about 20 reps of this to just kind of get those muscles warmed up. Now, a really great range of motion exercise is to look down towards your stomach. But when you do it, I like to tuck my chin back first, which is going to help lengthen the back of the spine. And you should feel that as you tuck your chin back, the back of your spine or the back of your neck gets longer. And then you're just going to kind of cascade forward. And again, you're going as far as you feel comfortable with. This one you may feel more of a stretch, and stretch pain is okay, but pain is not. If it increases your headache or increases your sensation of pain, don't go that far. But make sure that you tuck your chin first and then cascade down as far as you feel comfortable with and come back up. Now, we're not going to stay down at the bottom of this position. That can cause a lot of stretch, which when we come back up can kind of cause a reverberation, which will make it actually more painful. So again, this is active range of motion. We're just trying to move as far as we feel comfortable with and keep the slow and steady motion. Again, you want to do about 20 reps, and this should feel like it gets easier as you do more. If you start to feel that you're having increased pain when you're doing it, then just stop this motion because this one is not for you. Now we're going to put both of those two together, which can be really, really helpful to get the upper neck moving. So when we do the chin tuck and we cascade forward, from here we can now do this rotation from side to side. What this is actually doing is it's causing the lower cervical spine to be kind of locked into that flexion position, which forces the upper cervical spine to do more of that rotation. So it helps to get the muscles in the upper neck really stretched out really nicely. Now again, you can only go as far as you can pain-free. If this is painful, then don't do this exercise. It is a little bit advanced, so you may need to start with just the rotation on its own and the forward bending. Maybe you can add them together later on as your symptoms decrease and you start feeling better. Okay, now that your neck and your shoulders are feeling loosened up a little bit, they've got some blood flow in there, they're not feeling quite so tight, it's time to do some stretches. The first one we're going to start with is very, very gentle. I'll show you some progressions that you can do if you feel like you want to increase the intensity. But again, please remember, only do this to the sensation of stretch. Never go into the sensation of pain. The first one is going to be an upper trap stretch. So our upper traps are these big muscles back in here. If you see any like weightlifters and they got kind of like the wings, yeah, that's the upper trap up there. And what you're going to do is, again, sit up nice and tall, make sure your head is on top of your spine, and you're going to just tilt your ear towards your shoulder. From this position, you should feel a nice stretch along this right side for me right here. And we want to make sure you don't feel any pinching on the left side. If you do, you need to come out of that position because we don't want to allow that pinching to happen. Pinching can lead to pain. Pain leads to not the right direction that we're trying to go towards. Now, when you're doing this stretch, I recommend that you hold it for 10 seconds and then come up. I would definitely recommend if you're having headaches that you try it on the other side. And just holding it for 10 seconds, just allowing that muscle to relax. Now, if you notice that you really struggle with your shoulder wanting to come up as you bend over to the side and it's hard to keep that shoulder down, you can take your hand and sit on it. So just put it underneath your bottom, and then you can go ahead and stretch down to that side. Again, it's the same position, but your hand underneath your bottom can help hold that shoulder into place so you're able to get a little bit more of a stretch. Now, this is a more aggressive stretch, so if you feel like this is really painful when you do, or if it doesn't improve the stretch sensation for you, then I definitely recommend just do it without the hand underneath the bottom. Do what feels like a good stretch and avoid pain. Hold this one for 10 seconds and then make sure you do it on the other side. Now we're going to stretch the levator scapula. So that muscle starts in the upper neck and it attaches right onto the angle of the scapula or the shoulder blade. So it really crosses a lot of area. It's one that's meant to be a mover and a shaker, but sometimes we tend to use it when we're trying to control that posture, especially if we're sitting at a computer for long periods of time. We tend to kind of get into that forward position. So if you notice that you have increased neck tension after you've been sitting for a long time, either at the computer or while playing video games or while watching TV, this stretch will be really helpful for you. What you're going to do for this one is you're going to look down as if you're going to sniff your armpit. That's what this one's called, the sniff the armpit stretch. And what you're going to feel is a stretch along this right side here, all the way from my neck down into my shoulder. Again, you're going to hold it for 10 seconds, and then you're going to do the other side. When you're suffering with headaches, I always recommend doing both sides. So make sure you do both. Even if one side feels tighter than the other, it's going to be really, really helpful to do both sides. You can do 3 reps of that, but you can continue to repeat those regularly throughout the day. In fact, I recommend you do, especially if you do have a more sedentary job where you're sitting at a computer or something like that for a long period of time. Now that we've stretched more of the back of the neck, we want to stretch more of the front of the neck. Now this one you do have to be careful with because we want to make sure again that we don't get that pinching in the neck when we're doing this stretch. So last time we looked underneath the armpit. This time we're going to look up towards the ceiling and kind of tilt our head off to the side. This time we're trying to get these muscles right on the right side here, right in the front. You guys might even be able to see those here. And really get a good stretch to those. Again, make sure that you're not feeling any pinching sensation on the left side here, or when you go to the other side on the right side here, because if you're getting any pinching, that means the joints are getting really, really compressed. That tells you that your neck joints are not moving correctly. If you're getting any pinching sensation while you're doing any of these stretches, or even while you're doing the active range of motion, then I definitely recommend that you consult with a manual physical therapist, because what's happening is the joints in the neck are getting stuck and are not moving correctly, which means when you're doing all of your regular daily activities, it's causing joint compression, which can lead to pain and inflammation. That may be what started your headaches in the first place. And it may be something that's come on recently. It doesn't necessarily have to be with an injury. Sometimes it can just happen over time as we're living life and doing the things we do. Our bodies will allow us to get away with things for a period of time, but over time things can kind of start to wear and tear. And that's when we need someone to help us be able to move correctly. Because remember, every tissue in your body is designed to heal itself as long as it's moving correctly. So if while you're doing these stretches, you start to sense that you have a pinching sensation that's painful, you definitely need to find a manual physical therapist who can help you get everything moving correctly and get rid of these headaches for good. I hope you guys found this helpful. I'd love for you to click that like button below, and we make videos like this all the time, so click subscribe to get more information. Have a great day, everyone.